dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunitz, and this is Dr. Laura Chan. And our topic today is naturopathic medicine and allopathic medicine. And this is a great topic because, Dr. Chan, so many people are a little bit confused about what's the difference. So it would be great for you, if you would, to talk about what is the difference between naturopathic and allopathic and the training of each of the doctors.
Sure. It is really confusing, so I'm glad we have the opportunity to clarify it.
Yes.
Not only is there naturopathic medicine, allopathic medicine, but we have osteopathic doctors.
We do.
There's homeopathy, there's chiropractic, and it's very confusing.
It is.
So allopathic medicine is what we also call Western medicine.
That's right.
Or conventional medicine. Those terms overlap and essentially mean the same thing with what we're referring to. It's the doctors who have the MD after their name and who many of us have been to at some point in our lives as our pediatrician, our primary care provider, or specialists and surgeons that we go to. Just before I get to naturopathic medicine, so osteopathic medicine, those doctors have the DO after their name. And their training in some ways is very similar to a medical doctor or an allopathic physician with some of their own differences too. They focus more on some bone alignment and manipulation. Now, a naturopathic doctor, they're going to have the initials ND after their name.
And that is what you are.
That is what I am, yes. And a naturopathic doctor also goes through a 4-year medical school, just like an osteopathic doctor and a medical doctor. But there's some differences in the training. And the differences are that we get more emphasis on nutrition and on many of the modalities that fall under the heading of complementary medicine. So things like homeopathy are a modality, botanical and herbal medicine, and a huge emphasis on disease prevention. So learning what makes people well so that we can educate people and empower them to ideally stay healthy. So it's a modality and a training that emphasizes and really focuses on wellness. There's a term that we use in naturopathic medicine called the healing power of nature. And it really means 2 things, in my opinion. It means that the human body has the ability to heal itself when there's the stress that's making it ill is removed. And the stress that's making it ill, the goal is to find that and help take it out of someone's life. So it might be the food you're eating. We've talked a lot about that on this show.
Yes.
That might be something that's making someone ill. And so as a doctor, I'm always looking to see, what's the factor here that's making someone ill, and how do we remove that? And then ideally, the body is able to repair itself and restore its wellness. It might be a stressful lifestyle. That might be what's going on and contributing to someone's illness. And so in that instance, I'm trained with a decent amount of counseling, and I might talk to someone about that and how is stress affecting you? How does it change your hormone system? How is it really affecting your physical body? And if we can alter or manage that stress, then ideally the body can repair itself. And sometimes it needs a boost to do so, and there are many tools that are wonderful and effective for doing that. So when I say the healing power of nature, I mean that we really have this inherent ability to heal. When you get a cut, it heals on its own typically, most of the time. And if it doesn't, then you look for why that's not happening. With the healing power of nature, another thing that it means, in my opinion, is that there are things in the natural world that have tremendous ability and therapeutic value to offer a healing for the physical body. So herbal medicines are a good example of that. They've been used for thousands of years, and now we're able to do a lot of research on them and see, wow, these plants really are powerful and really are effective.
So does a naturopathic doctor use more herbal than an allopathic doctor?
Typically, yes.
Okay.
Yes, a naturopathic doctor gets a lot of training in herbal medicines and learning how to use them safely. One of the most important things that we need to learn is the interaction between herbs and pharmaceuticals.
Absolutely.
So, for instance, a patient might come in and they say, oh, I'm on these 3 medications, but I read that this herb is helpful for my joint pain. So I bought it and I've started taking it. And it's my job to know, is it safe for you to be taking those? Does it interact with those medications that you're taking? Or perhaps they're not on something, but I think, okay, well, with the symptoms you're coming in with, there might be something else that's helpful to address what you're going through, but I need to know for sure that it won't interact or interfere with what they're already taking. So not only are we trained in the therapeutic benefit of certain modalities such as botanical medicine, herbal medicine, but we were trained to make sure that there's not going to be an interference between what they're already doing. So along those lines, it's really about complementary medicine. It's medicine that complements what they're already doing with another provider. It's not about replacing.
So you decided to go in, you were originally going to go into becoming an MD, a medical doctor, going down the route of allopathic, but then you ended up becoming a naturopath. I think it would be very interesting for our audience to learn why you made that choice.
Sure, absolutely. And I struggled with that choice. That was a hard decision for me. I was doing the pre-med track, and for both naturopathic doctors and allopathic doctors, you have to complete the same pre-medical training.
Yep.
And I was in college and I was doing that. And at that time in my life, I got very ill. And it wasn't just one quick, sudden illness. It was this chronic, I just was feeling terrible all the time. I was exhausted. I had a lot of digestive symptoms. I had a lot of mental brain fog. I just felt lousy, and I was really struggling to get through my days and finish my schoolwork. I went to see my primary care provider. They ran the basic lab testing, said, we can't find anything. I ended up seeing a variety of specialists. They weren't able to find any answers for me, and I still just felt so crummy. You know, long story short, I ended up going through a surgical procedure that wasn't helpful, trying several medications that weren't helpful, and just feeling kind of at my wit's end at that point. A friend of mine said, hey, I had a great experience with this naturopathic doctor. Why don't you go give it a try? I didn't know what to expect. I felt a little bit desperate at that point and really willing to try anything. So I went. This was the first doctor of the many I had been to who asked me about my stress levels, asked me about my diet, what I ate, and then made changes in both of those categories. And that was really all that he did to start. He made a huge shift in my diet. And I was in college, so I was eating pizza, and I was eating like fast food like a college kid, and it wasn't serving me, it turns out. So when he instructed that I change my diet, within 2 weeks, I started to notice a difference. After feeling chronically ill for, by that point, it had been years
What
that
was
I
the
was
difference
really
you
not feeling well.
initially felt?
I
Did you have
initially
more
felt more
energy?
energy. I felt more energy. I started to sleep a little bit better. My digestive symptoms got better. I had been diagnosed with fibromyalgia, so I had been having this body pain all over. That started to improve. Within 2 weeks, I started to notice improvement. Within 6 months, I was a different person. Totally
Amazing.
different person. It was amazing. And during that time, my naturopath also recommended some supplements for me to take, not long-term, not like a long-term medication, but just temporary to help address some of the symptoms I was experiencing and help improve my digestive health. They made huge differences for me.
Now, was your naturopathic doctor communicating with your medical doctor along the way to help them know what they were finding and doing? Or
I
how
didn't
was
ask that of them at the time. I was the one that was the go-between.
Okay.
And frankly, I wasn't even seeing another medical doctor at that time because I felt like I had hit a dead end at that point. So my naturopathic doctor was managing everything at that point.
Yeah.
And so by the time it came for me to apply to medical school, I was really torn because I still had this idea that medical doctors are better known. Maybe I'll be taken more seriously. I was afraid that maybe I wouldn't be taken as seriously if I went down this path that not as many people knew about. But I had to follow my heart. I really did. And I sat with this decision for a while, and I just said, I really want to do what was helpful for me, ultimately. And so I ended up going down that track and deciding to become a naturopathic doctor. And I haven't regretted it. I love my job now. So.
That's wonderful. So tell me, is there much communication between the medical doctors and the naturopaths? Is there a camaraderie? Do they discuss things? Do they talk about things? Or are you kind of operating more in silos, separate?
It's really getting better, the communication. I think the lack of communication historically has been a lack of understanding between the two, that there's been a preconceived notion that naturopathic doctors might not be well trained or don't have an understanding of science, so therefore there might not be a common language between the two. But I think the medical doctors are starting to learn, they do have scientific language and understanding, and they have all that same training. And so we can at least have a dialogue on the same page. And frankly, it's really important that we do have these conversations.
It really is. And why is that? I think it's important for our
Well, it's
audience to know.
essential
It's
for the patient
critical.
care.
It is.
Right? And just this past week, I called up a gastroenterologist. I am working with a patient with pretty severe ulcerative colitis. And this patient came to me, and she really wanted to do only natural things. She was afraid of taking medications. And I had to say to her, this is a point where your condition is so severe that I don't think natural medicines are appropriate for you to only. There are things that can be helpful, and I can work with you on your diet to help reduce inflammation and perhaps one of the triggers that's contributing to this colitis. But your situation is so severe that I think you really need to be working with your medical doctor and taking the medications that they recommend. And I called that doctor, and I told them, your patient came to see me. She was nervous about the medications you had recommended, and I want you to know that I really encouraged her to follow your advice, but that the role that I would like to play is helping her with her diet, and that's my role here. So I made it clear to the patient and to this other doctor.
And how did the doctor receive that?
She was great about it. She said,
Excellent.
thank you so much for calling me.
Good.
I'm glad we're on the same page here.
Excellent. That
so
is
it was
terrific.
great. It was great. And then it was clear to the patient, your gastroenterologist is going to manage this part and do the medications. I'm skilled at doing the diet piece and helping you with reducing the inflammation and some of the other aspects, and these things can work together.
And will there be communication between the doctor and you related to the continuing care?
I anticipate
I would hope
so.
that would occur. That's, in all walks of life when it comes to medical care, there's not even a lot of discussion related between the specialists and everybody's trying to make that better, but
it is getting better.
The team approach.
And it used to be, back when I was starting to see a naturopathic doctor, I was afraid to tell my medical doctors that I was doing that because I was afraid that they might judge me or think I was doing something unsafe. And so a lot of patients won't tell their doctors if they're taking any supplements or herbs on their own, or if they tried something that they read about on the internet. And it's so important that we're upfront and we're sharing what we're doing.
It really is. It really is, because if we miss a certain point, then we're not going to get the best care that we really need. So why would somebody come to see you? What is the type of patient that should really consider, I'm having this, and that, I should go to a naturopath? Why would they go to a naturopath versus a medical doctor?
So the conditions that naturopaths see most commonly are things like chronic digestive issues, allergies are a really common one, hormonal imbalance, insomnia, symptoms of just feeling stressed or run down, fibromyalgia. A lot of chronic illnesses or chronic conditions are the most common reasons that someone will come to a naturopathic doctor when they're looking to achieve more wellness. Now, I always draw this pyramid model when I'm describing where naturopathic medicine fits in. So if this pyramid is all of medicine as we know it, and we have surgery and we have medications, those are here at the top of this whole health pyramid, and those are absolutely essential at times. They're necessary, they save lives. It's so important that we have well-trained surgeons and doctors who can manage these medications, which are really necessary at times. And down below that, here at the bottom of the pyramid, I call this the foundations of health. I call this is where we're dealing with stress management, we're dealing with nutrition, we're dealing with prevention of disease, ideally to prevent this need for medication and surgery. And we're dealing with what makes people well. This is what I'm good at here, and this is what most naturopathic doctors, it's this foundations of wellness. And so that's the role we play. If we're thinking about a healthcare team, someone might need a surgeon, someone might need a specialist, but then someone might need a naturopathic doctor to help them with recovering and with wellness and playing that role.
Prevention.
And the
Prevention is huge.
Mm-hmm.
In fact, I think as we move towards the medical system beginning to change and to work out some of the things that they need to based upon consumer, I would think, demand, I would imagine that we'll be seeing more and more emphasis on prevention.
Absolutely.
Because if we're to look at the human being, we really need to not see the human body, the mind, the body, and the spirit as something that is sick.
Right.
Or has a problem. We really need to look at it in a very positive way and talk about what can we do to be at the best health possible and to prevent certain things to happen. Now, that doesn't mean when things happen that we don't get the best of care. So it's important to have all of these other providers available. Now, do naturopathic doctors, are they able to write prescriptions? Do they go into the hospital at all and see their patients? Do they do rounds? How does it work?
These are really good questions. Here in the state of New Hampshire, naturopathic doctors are considered specialists. So essentially, we're integrative medicine specialists. We do not work in the hospital, so we work in an outpatient setting only. In some states, naturopathic doctors might work at cancer care centers, things like that, where there might be some inpatient facilities. But for the most part, it's not emergency-based medicine. It's not hospital-based medicine. It's outpatient care, often in private clinics. In New Hampshire, naturopathic doctors have prescribing rates. I can prescribe antibiotics, I can prescribe hormones as needed, I can refill someone's medication that they're on. Not for all medications. We have a very set list here in the state of New Hampshire of what naturopathic doctors can prescribe, and that was determined by a board here in New Hampshire. In different states, it's different. So each state regulates naturopathic doctors a different way. Some states don't license naturopathic doctors and they don't have prescribing rates, but many states do. And in those states, we can prescribe. I can order laboratory testing, which I do often. It's very helpful for determining someone's level of wellness and helping me get them into a more optimal place. I can order an X-ray or an MRI if I need to. And so we have a lot of those same privileges in our scope of practice.
So when we talk about laboratory work, does a naturopathic doctor have a different focus than an allopathic doctor related to what they're looking for, even with lab tests?
That's a great question. So I do use the same labs that most doctors' offices would use, these nationwide big, huge labs that insurances cover. I do use those labs mostly, so someone can come in with their insurance and we can run it through there. And what I'm looking for when I get labs back, I'm trained to really understand optimal levels of perhaps hormone or nutrition balance. So for instance, someone might get their labs back and it says, okay, well, your thyroid is in the normal range, so it's not a thyroid problem. I might look at that and say, well, technically it's in this normal range on the lab testing, but is it in the optimal range? Because that's a pretty big range that's on there, and it's oftentimes people who aren't healthy that they've measured and developed this range on. So it can be really useful to understand, okay, I'm seeing that, yes, there aren't red flags here on your labs, but it's not necessarily in the optimal range. And that's, again, when we're down here at the foundation of health and we're really trying to achieve wellness and optimal health. I want my patients to feel vital. I don't want them to just not be in the hospital. Right. I want them to feel excellent. And so I can look at the labs very often and say, well, yes, you're clearly not in need of emergency care here, but you're not at an optimal place. And so there might be things that we can do nutritionally to shift this, or it might be out of whack because of your stress or something like that. And so I'm able oftentimes to interpret their labs in a pretty nuanced way that helps me understand how are they getting tugged on here in their stress.
Now, you mentioned that laboratory work is covered by insurance.
Yes.
Is the general visit to a naturopathic doctor covered by insurance?
It depends on what insurance.
Okay.
Not every insurance covers naturopathic medicine, but here in the state of New Hampshire, there are several plans that do. Many of the big plans do. And so if people want to find out if their plan covers naturopathic
Sure.
medicine, they can just call their company and ask.
Now, do they need a referral to go to a naturopathic doctor?
It depends again on the plan. Some plans require a referral and some don't. But because we're licensed as specialists here in the state of New Hampshire, if someone has a plan that requires a referral when they go see a specialist, they would also need a referral to come
So
to
as a
us.
specialist, somebody comes to you and you're taking care of them for a variety of different reasons because they want a naturopathic approach to it. What happens if there's an emergency and somebody requires hospitalization or further care? How do you handle that?
So I always tell my patients that they need to maintain a relationship with their primary care provider.
Excellent.
And so they'll ask me, frequently I'm asked, can you be my primary care provider? And I say no, because I don't have hospital privileges here in New Hampshire. I can only serve as your integrative medicine specialist.
Okay.
So you must maintain a relationship with your primary care provider, and we're going to serve you in different ways anyway. And then if there's an emergency, they're going to be your point person for getting you in the hospital.
And so if they need to be followed or anything happens, it's the primary care provider that will take that on.
And if someone doesn't have a primary care provider,
Yes.
I'll often refer to urgent care or something else that's local and give them the resources to get there, or an emergency room if need be.
That's wonderful. So related to people on knowing how to choose the best naturopathic doctor, how would they go about doing that?
That's such a good question, because naturopathic doctors do have their own specialties,
Yes.
so to speak.
Okay.
Some might work more with children,
Okay.
some might work more with hormones, and some really branch off into their own specialties. So it's important to do a little bit of research. First and foremost, most people want to see if their insurance covers. So you can contact your insurance company and you can see if there are any naturopathic doctors that fall under your insurance
Are
plan.
there certain credentials to look for so that you know that you're going to the best naturopathic doctor that there is?
Well, you always want to make sure that they have the ND and they've been to an accredited school. Some people, some herbalists and some other professionals might use the term naturopath because that word isn't necessarily closely regulated. So it's very important to
That is a good
share
point.
that bit of awareness.
So a naturopath
is different than a naturopathic doctor. It's important that they have the ND after their name. And
So what does a naturopath do? That's totally different.
it's a loosely regulated term,
Ooh.
so it could be
So
a
it's
few
very
different
important
things.
for our audience to know that if you're looking for somebody that is trained and accredited and board certified,
Yes.
you want a naturopathic doctor.
Correct. Yep.
Okay. And so they can look for this online or go into the
You can
board?
look online. We have a board here in the state of New Hampshire, the New Hampshire Board of Naturopathic Doctors, a New Hampshire Association of Naturopathic Doctors, NHAND.org. And so that's a website where someone could go here in New Hampshire and
Okay.
specifically look at the list of all of the licensed doctors here in the state of New Hampshire.
And will it
we have
list the specialty?
Often it does. People will say what they focus on, what they do. Some specialize in digestive health. There's celiac disease management, and it's listed on that site. And then there's often a link to their individual website.
And how many? How many in New Hampshire?
There are over 100 who are licensed, but who are currently practicing. I think we have over 65.
Over
So it's a small
65.
profession.
Yes, but it's building and it's
It is.
growing. And so for our audience, as far as, again, just if they're just happening to come in to listen to us, what would be the most important things that they could realize that a naturopathic doctor would be able to help them with?
Naturopathic doctor really excels at helping someone achieve wellness. So it's so important to know that you can go to a naturopathic doctor and they will look closely at all aspects of your health, not just your physical body, but your emotional well-being and your relationships, your social aspects, all things we've talked about on this show that contribute to your health and wellness. And they can be a good point person to really help address balance in your life. And maybe if you've been to a variety of doctors and just feel like you're slipping through the cracks, a naturopathic doctor might be able to take a broader view and say, okay, I see here that this and this is going on, and these might be impacting you. And so there are some things that we can try that are safe and that are lower force interventions to experience and see if that makes a difference for you.
And your style is to be able to communicate with their primary care providers or their specialists or whatever, so that they know what you're doing and that you can coordinate the care related to that, which is wonderful. And if people wanted to find out where you were located, where would they find out where you practice?
I'm also on that New Hampshire Association of Naturopathic
Good,
Doctors
so that
website,
they can find you there.
That
And that's a good
information is
place
there.
for people to look for a doctor. Please don't hesitate to reach out to us at info@ycdholistichealing.com. There is a difference between naturopathic medicine and allopathic medicine, but both of those fields are there to help you in every way to lead a very healthy and good life. And it's that combination, right?
It is.
That you were
It's the
speaking of.
integration. It's so important that we're all working together and having this team approach,
That
because
team
we
approach
all have
is
something
really
to
important.
offer.
It's
Absolutely.
true, because without everybody working together, it's almost like, when in education, the student comes first. The patient really needs to come
patient comes
first.
first,
And if we
absolutely.
put patient needs first, then there's no excuse for anybody not to be able to have a great team of people working with them to help them in their health and wellness, right?
Absolutely.
And that's what we want. We want
That is.
everybody to have a great team, because when we know that we've picked a great team of people, we know that we have the best chances working on our own of what we need to do, but working together to make a difference. So again, we're so delighted that you came and that you're with us today. And for further questions or information, go to info@ycdholistichealing.com. It's important for you to live each day to the fullest. Breathe, live, love, laugh, and be present, and take excellent care of yourself. And the reason why you want to take excellent care of yourself is because you're very special and you're here for a reason, and life is worth living to the fullest in a healthy and happy way. Thank you for joining us. We look forward to seeing you again.